Fractured clavicle. The clavicle, or collarbone, is a long S-shaped bone that connects the sternum to the scapula. It aids with stabilizing the shoulder and allows for full arm movement. Because of its exposed position and the force it absorbs during impact, it's one of the most commonly fractured bones in sports. When the clavicle fractures, surrounding structures are often affected. Muscles like the sternocleidomastoid, trapezius, deltoid, and pectoralis major may be strained or displaced. These structures are essential for shoulder strength, mobility, and coordination, critical for athletic performance. In athletes, clavicle fractures most often result from direct trauma. High-impact collisions like a hard tackle in football, a crash in cycling, or a fall during snowboarding can transmit force directly through the shoulder, causing the bone to break. These injuries are common in sports where falls or hits are frequent. While stress fractures can occur in rare cases from repetitive overhead motion, most clavicle injuries in sports are sudden and forceful. Acute fracture symptoms include severe pain, swelling and bruising, deformity and bumps, a grinding or cracking noise, and limited shoulder movement. I did note that stress fractures are rare injuries and typically result with dull pain and tenderness over time. Recovery depends on the severity of the fracture and the treatment approach. Non-surgical cases typically heal in 6 to 8 weeks, while surgical repairs may take 3 to 4 months. Athletes must avoid contact and overhead activity during early healing because a gradual return to sport is essential to prevent setbacks and ensure full recovery. Rehab after a clavicle fracture begins with immobilization. Most athletes wear a sling for several weeks to keep the shoulder stable and reduce movement. During this phase, ice therapy can help manage swelling and pain. Once healing begins, rehab shifts to restoring mobility. Gentle movements like pendulum swings and assisted shoulder flexion prevent stiffness. As strength returns, athletes progress to isometric exercises such as shoulder abductions against a wall, internal rotation with a towel press, and scapular retraction holds to activate stabilizing muscles without stressing the bone. Later stages focus on sport-specific recovery. For example, a football player recovering from an acute fracture may work on shoulder impact tolerance and blocking mechanics. A swimmer recovering from a stress fracture would focus on stroke efficiency and shoulder endurance. Across all sports, functional movement patterns restore confidence and reduce the risk of re-injury. Complications can include non-union or malunion, where the bone doesn't heal properly. Non-union is when the broken ends of the bone do not connect. Malunion is when the bone heals but not in its correct anatomical position. In some cases, the fracture shortens the clavicle, altering shoulder mechanics and increasing the risk of re-injury. Athletes might also experience long-term weakness or reduced range of motion if rehab is rushed or incomplete. Understanding clavicle fractures in athletes from anatomy and causes to symptoms, recovery, and rehabilitation is essential for a safe and effective return to sport. Whether the injury is acute or stress-related, proper diagnosis, individualized treatment, and progressive rehab are key to restoring performance and preventing long-term complications. With the right care, athletes can heal stronger and smarter, ready to compete again with confidence.